want to share some of my holistic health knowledge. I will start from introduce myself briefly and explain why I want to talk to the people in the community. And then I will discuss individualism in health. And I plan another topic is taste and life and health. But I think probably I want to spend more time on the one topic, maybe just briefly for the second topic. Then we can spend more time, ask questions, answer questions. My name is Nen Huang. I'll be a nurse for 40 years in 3 different countries. I started my holistic nursing in 2008 with Lisa. She's studying and getting her certificate. I get my certificate in advanced holistic nurse. I had my health and wellness nurse coach. I had my master's degree in nursing education 2010. In 2020, I get my doctorate degree in nursing practice.
In nursing?
Yeah, in nursing. That's nursing with a doctorate degree. Couple years ago, I learned that aromatherapy was accepted in palliative and hospice nurse. So I get a certificate in palliative care and hospice nurse. So that's what I want to focus on today. I want to use 2 symptoms or 2 diagnoses to explain both in Chinese medicine and modern medicine how we look at blood pressure, high blood pressure. Another one is constipation. So maybe not so many people want to talk about it, but it's really an issue. We really wanted to share some knowledge and how to take care of. So maybe not as many people have this problem, but as I know, so there's so many people have this problem. Let's start from hypertension, high blood pressure. Have you heard this saying? If you start a medication, you will continue for all your life. So I asked who heard this saying, or not necessarily doctor talk to you, or you might heard from friend or other people. So anyone heard this?
I haven't heard it, but I assumed it. Yeah. Did you? Like hypertension, cholesterol, those are issues for me. And I just assumed, all right, I'm old, I'm reached this age, which is what, 79? I'm not going to get off those meds.
Yeah, that's
a doctor tells me.
Yeah, that's what happened now, and then I'll explain. Maybe we can do something else to complement what you are taking, and then maybe you can either decrease your medication dose or even stop it. But if you have been on medication for a long time, probably very difficult for the complementary to do the major job. Let's explain in Chinese medicine. We talk about individualism. You know, American is famous for individualism, and we want individualism in where we eat, which restaurant we go, what kind of clothes we wear, where we live, right? We want the individualism. When it comes to health, where is the individualism? So I want to ask you a question again. What's health mean to you?
Health, what does health mean to us?
Yeah, to you.
I keep on thinking of the phrase, the American phrase, keep on trucking. You know, keep on going as long as I can. And
The most positive way.
in a positive, that the joints have to work.
Okay.
That's why I take the exercise class.
Mm-hmm.
I'm thinking about my joints. I want to be able to stand up as well as I can. I don't know at this point what to expect. I don't think anyone in my family has lived beyond the age of 70. Than our parents, really.
Mm-hmm.
So I think I'm doing pretty well.
Yeah, I heard that you said keep going. So
Just
keep
on-
going.
keep
That's a
on trucking.
process, right? And anyone else want to talk about what health meant to you? Suzanne, you want to talk about?
What health meant to you?
Yeah, what health meant to you?
What is what?
You represent yourself. What health meant to you?
What health means to you.
What?
What does health mean?
In your own word.
My own word?
Yeah.
Healthy. Your system gets enough food, nutritious food, and you exercise. You're talking about health.
Yeah.
Positive living.
Positive living. Yeah.
What else? I don't know.
Yeah, you talk about eat health, nutrition, you talk about exercise, you talk about the positive living, so you mention about the physical, emotionally, spiritually. You actually mention it holistically. So, yeah, you holistically, you over the big picture, you look at every aspect of your life for health. So who else?
Well, my whole life has been dedicated to health.
Uh-huh.
I mean, in high school, I had health subjects, went on to college, had more health subjects,
Yeah.
and graduated from college with a master's in health.
Yeah.
Spent the Air Force in health.
Mm-hmm.
So in lab communications and lab work all the way through, and I just hit 93 years old.
Oh.
So, and I'm still in the health orientation, so to speak. So health has been everything.
For example?
I mean, right now, I'm out of health for the first time since September. I'm not in the health field actively. So I miss it. I mean, I've only been here 3 months, so
You said you come here because you're out of health, you said.
for lack of my health,
Yeah. Okay.
I'm here.
Anyone else want to share? No? Okay, let's go back to the hypertension. Every hypertension to every person might be different cause. And Chinese medicine principle, so they categorize in two. One is overactive of yang. Let's say just one factor. Something is overactive. Like when you're angry, anxiety, or you take alcohol, smoke, all these things get into you, and there's some excess in your body, your blood pressure getting up, it's easy to understand the high blood pressure, the excess. But another category is insufficient. So how the inefficiency can cause high blood pressure. So when you don't have enough energy, and then your blood pressure, your body want to help you try to increase the pressure to give you more energy. I will use a different analogy, you will understand better. For example, a water pond. So the water become dirty, polluted. The water become musky and dirty. What we normally do if we want to clean the water? Okay, now I need answers. See, what we normally do if we want to clean a pond, water pond, what do we do?
Drain
Huh?
it. Drain it.
Drain it. Okay.
Filter.
Yeah, that's one.
It is. The
You
water
get
was
the
clean.
bird to.
It was clean in my perspective.
Yeah,
Didn't
but
you think
that's
so?
not drinking water.
No, it was not for drinking.
No, I think you. We'll talk about how you clean the water if the water become dirty. So you said bring the bird.
Well, the birds came. We knew we couldn't swim in it, you know, but it was beautiful. It was very, very nice to see that they had a place to go. And then you could see, you know, the whole progress of life taking. You could see the ducklings. What do you call those swans that and the little babies, cygnets or something like that. Yeah, and it was beautiful. It was not.
Attitude.
It was not brown. It was brown, but it was. We figured it was clean. And it was great to walk around and watch.
If you want to clean, what you can do? As you said, the bird is coming and help to clean the water as well. The bird can, pick up some stuff in the water
And that was in our job. That's what we were paying for in the condo. We were but it was something that we could walk around in various seasons and see the changes, and it was beautiful between the foliage and the island, and nobody tried to go out there except the people who would come out at the beginning of, say, summer and fall, clean away the waste. And,
Drinking water.
no, it wasn't for drinking. It was for just pleasure.
Okay, yeah, you mentioned about the bring the bird for cleaning the water.
Yeah, and that was up to the maintenance people.
Okay, yeah, he said drain the water, okay. Any other idea? Richard, what's your idea?
You want the water to serve a purpose too.
To clean the water, what do you do?
To clean the water,
Uh-huh,
there are different methods that are being used now.
okay,
One is insecticides, one is pesticides that are taboo actually, because most companies don't want to use them.
okay. What else you can use?
And you have all the major companies all have methods that they put in the water,
Okay,
have materials that they use. And some are good, some are not so good.
so that's one thing, to put a chemical. What another strategy you can use. Chemical, you can use a different chemical, and that depends. So that's one category. You put a chemical to clean the water. Any other strategy we can use to clean the water.
I'm sure there are many we don't know about.
No, just your idea.
Chlorine.
Uh-huh.
Chlorine is one
Okay.
major one used in swimming pools.
Uh-huh.
And acids are used.
So we can leave that detail for later. So I mean, except the chemical, what else? What other strategy you can use?
To clean the water supply.
Yeah, to clean the water, just the pound of water. At least clean before they're contaminated.
Before they're contaminated.
Yeah, clean to that level. What do you do? What you can do?
I'm not sure what you're getting at.
Yeah, just a strategy, not the detail in chemical. Okay. Who else? Go ahead. Your idea. You said the bird, and you. What's your idea?
I'm just gonna say, put chlorine in the water.
Okay. Anything else? Any other can, and then put a chlorine there?
Well, are you talking like swimming pools
Just the
or
pH?
just?
No, just a pound, just a pound of water and get contaminated. You want to clean it like it was before.
You can
Wait a
introduce.
minute, you want to use, well, of course, I'm talking about when we were living in Grand Rapids, I would see people out with people with nets to pick up the dead leaves that got in the water, and that got it out of the way.
Yeah,
And
that can be one way.
I would think that they allowed it to take a natural course and allowed, I don't know, was there fish in that water? I don't know, I wasn't a fish person. But they had,
Stocked it, I think.
did they stop it? Maybe there was something that the fish did.
Okay, James.
You can introduce plant life that can absorb bacterias and other stuff in the water, the algae and stuff like that can eat bacteria.
Okay.
Would be my.
So are we talking about health issues or clean water?
I will make this example connect to, I will talk about the next. How I connect this clean the water with hypertension, high blood pressure.
Okay.
So I want to make the connection. Okay, so
Good
let's
analogy.
stop from here. For human body, when you have all this toxicity in your body, smoke, anxiety, anger, the emotional toxicity and the physical toxicity, you smoke, alcohol, all those chemicals in your body, so your body has a toxin, it needed to release it, right? So he mentioned the outlet. So that's always good. That's good for you. Put a chemical, you put a fish in there, other plant in there for circulate. The main thing is you want the water flow, right?
Yeah.
That will clean. Like the water, the river will clean itself because it's flow. For the outlet, when you use a chemical, it can be clean for a while and then we go back to the same thing. Our body has this toxicity. The body just do itself, has a self-healing. That's a self-healing. Self-healing, if you get a cut and then it heal itself, you don't need to do anything, it heal itself. Same thing as inside, you don't see it, but your body manifests. What your body want to do? Try to give the outlet, let the toxicity come out, and then inject fresh water in there. So let the water flow. Your body, while your body increase the blood pressure, You know, when you have to let it flow, you have a certain pressure to push it through, right? So we need the pressure to push that. Why that high? Because your body try to push this toxicity out, and then you just keep coming too much. You don't stop the toxicity. Your body cannot get rid of enough, quick enough. So they have to increase pressure to push it out. So that's why before you get the medication, so you want to know what happened, what toxicity your body try to get rid of, right? So your body to increase the blood pressure to help you. So that's explained in Chinese medicine. If I use the balance, we want to use the balance to effect balance. If 5, 5 is balance, 2 sides balance and 5. And then if 5.5 maybe don't manifest anything, maybe 6, your body will manifest anything excess, will manifest some symptom. And if other side go lower to 4, so your body manifests something to show you symptoms. How about if one side is 4, another side is 2, but it still manifests excess symptoms, but you don't know. You cannot identify if this 4 manifests at 4 level or at 6 level. Maybe one side is 4, another side is 2. So there's 2 different. So it will manifest the same as 6 and 5. So now you see the excess, but you cannot remove it because you needed to lower this 2 to 4, so to become a new balance, new level of balance. So that's why the high blood pressure can be different. So let's go back to the conventional modern medicine. Modern medicine, and we come to the doctor, the blood pressure is high. You might heard a word called white coat blood pressure, right? Yeah, some people have that, but you don't know unless you check it at home. Yeah, especially when you check your blood pressure at home, you want it in a good position. You want to, if it's after activity, you want a few minutes, calm down for 5-10 minutes. Then you check your blood pressure. Or after you get up, 15 minutes, you check the blood pressure. So you want to compare if that is really false information you get. They do have. I have a friend who have that one. He doesn't feel anything. He go to the doctor, they check the blood pressure 159. So he don't believe. So he go back to check it. The doctor said, "Oh, you have they check more than one time." So they said, "Okay, want to make it accurate." So they check more than one time. It's 159 or 150 something. So he doesn't believe, so he went home and he checked it again for 2 weeks. So his blood pressure is 130, 140. For a 65 years old, should be okay. Yeah. So he's not taking blood pressure pills. But if we see, okay, I want to follow the doctor order, yes. Let me give you an example. The doctor orders. I have a patient have been taking 3 blood pressure medicine. He takes the HCTZ, linezolid, metoprolol, all these 3 will lower his blood pressure. and for some reason he come to the hospital. His blood pressure was 90 or 80s. So doctor added another medication to increase the blood pressure. I don't know what you think about that.
Not too smart, you know. I think that if I see somebody, you know, with a stethoscope around their neck, or I'd rather just exercise. I know that I'd like to go to a more natural way of controlling my system. Maybe that's the way I'd go for a walk outside, although we haven't done that recently. Anything to avoid going to the doctor.
Yeah, you still go to doctor, that's what they do. So until I asked the doctor, I asked the patient, I said, why you take 3 blood pressure medicine and then we have to getting too low? He said the doctor ordered from different doctor. And I have asked the doctor, why he take it? Doctor said, oh, why he need it? I said, what we can do? So finally I remind the doctor to reduce 1 or 2 the high blood pressure medicine, so we don't have to add the number 4 medication to increase the blood pressure. All this medication go to the kidney, causing you a kidney failure.
Right.
You see so many kidney failure is from the medication.
Yeah, filter it.
Yeah, from the medication. So that's why so soon continue on start the medication is not blood pressure medication is not a good idea. Like we talk about it, your body want to help you remove all those toxicity, and then you press that. No, don't do that. What happened? The body will continue doing that for a while, right? The body knows it is what they want to do, what they need to do is compensate what is the problem, want to heal itself until the body cannot compensate, until it totally lost the health self-healing ability.
Why don't you just drink more water?
Yeah, that's one thing. You know, we can talk about what you really needed. So, in the modern days, we have all different medication, different blood pressure medication. You look at the education material, you will find one single thing they call widen your blood vessel, right? So when the blood vessel widen, the pressure down. But what that will do, if the toxicity is still in there, so how widen is there? It's not going to help your body, just the other way around. He mentioned very good. You have an outlet. You want to open the outlet. You want to inject. So there was some complementary. I was using acupressure. Later I will teach you 2 very simple acupressure, then you can do it, you know, to help your health overall. So that's the reason. That's why the body has a healing potential. We all know. You know, nowadays the people have some disease in later on life. Before, people don't live like now. That's why we have some disease. We call disease, might be not necessarily that a disease. Let's see, the blood pressure is not a disease you want to take care of. You want to see why you have the problem. You want to help your body to heal itself. So that's what we need to do. That's what I want to talk about. I don't want to see many patients that come to hospital and with all this unnecessary suffering. That's why I want to spread the knowledge, the complementary knowledge of holistic health to as many as people, so we can be healthy. Either you said walk or drink water, or that will be a different issue. Will be a different way to taking care of a different person. Even the same hypertension, you can deal differently. I have another blood pressure case. I had a case report. This man was mistreated, was captivated without a reason. It's not a prisoner, but he was captivated. So his blood pressure later on was from combination of 3 factors: deprived of sleep, and limitation on activity, and emotional distress. So 24 hours a day, the spotlight shone on him, including the sleep. You think how he can sleep? Even he finally too tired, he go to sleep. There's 2 bodyguards, 24 hours. Will wake him up in sleep. Don't put your hand under the blanket. Put your hand out. And start sitting on a small chair, small one. You're sitting there from 7 o'clock in the morning to midnight. And then continual interrogation, endless, for 2 months. And in the middle of that, his blood pressure went to 200, heart rate 120 or 130. There's a doctor there. One doctor paid sympathy to give him permission to sleep 2 hours early. Even this 2 hours of privilege was taken away later on. After these 2 months, his blood pressure has been high. So anything, he's a strong man, very able man, and he can do all those big things, all these creative ideas things. Now he can even talk with a friend for 20 minutes. His blood pressure will up. So that's how much these factors can affect you. But if you keep these factors there, you want to suppress the symptom, it's not going to work. For this man, he has to use some medication because that's too high. So he has to use medication and complement with some other modalities, acupressure, aromatherapy, and so many different complementary modalities. So in summarize, we want to get into what are causing this, why your body has these symptoms. Then we take care from there. We spend a lot of on the hypertension, and I want to talk. I do want to talk to the talk about the constipation as well, because that's major. That's especially for people over 70 or once will be an issue. And oftentimes doctor will order stool softener to start with, right? Stool softener, laxative. But for the elderly, the elderly can be any age, because just per different person can be different. For elderly, the soft stool actually is harder to eliminate because the lack of the form, there's no stimulation to the colon. So actually, it's even making it harder. The constipation can be many different reasons. You know, simply you don't have enough fiber. You can take a fiber. He mentioned about the water. Maybe they don't have enough water, so you can drink water to keep it. Oh, there is a major fact normally we don't think about is your energy to push that through. When you're aging, your abdominal muscle is weaker, so it's weak to do that, and that's outside. And the inside, in the Chinese medicine, we call it the yin deficiency. You don't have the enough energy. So if it's a muscle itself, get weaker, or you don't have supply for that energy for any reason, you don't have the supply for the energy to push it through. That way, we need to supplement that energy instead of we get a laxative, get a stool softener. That's not going to work. Even though there's a more softening is harder, so it don't work that way. Unless suppository or laxative might work when the stool is really hard, and lack of water. So that one may work at that time. But you have to look at the different cause, what are causing it. Then we're taking care of. To increase the energy, actually there was a very simple, there's a few other pressure points I can show you, but there was one is very easy to do, so you can strengthen your body, can stimulate your intestine, so they can keep moving, if have the enough pressure, have enough force to push the through, and you keep the stool soft enough, not too hard to keep it open. You work on the meridian. You work on strength your meridian. Oh, okay, meridian. Probably not everyone heard this word. It's a Chinese. You might heard about acupuncture, right? Yeah. Meridian is energy channel, the qi channel.
So where is it?
The I will show you real quick.
Okay.
The acupuncture is you use the needle inserted in certain point, but you don't have to go to acupuncture at the beginning first. If you can take care of yourself first, you don't have to go too far. In Chinese medicine, the health, actually not say the medicine. In Chinese medicine, they don't start from herb immediately. So they start from, you use a stone, so you scribe, like a scribe someone, sometimes there's no stone, you can use even a spoon to scribe on certain meridian to work for that. The stones, the moxie, and acupuncture, acupressure, the end strategy, it is using herbs. It's inside. But before that, there were so many things you can do. Okay, now let me show you how to do that. It's easy, okay? So there's a meridian. The body have, commonly we use 14 meridian. It's all vertical. 3 here, 3 other side, 3 on the leg, 3, so total 12, and 1 in front, one in back. That's normally 14, this 14 meridian use very much. And there's one go horizontally to link this every 12 together. That's when you work on this link meridian. So you work with all these 12s. What we do is, your waist from here and to the middle. Yeah, just tap out. And when you sleep, before you sleep, after you go to bed, lie down there. Just do that 200 times, 300 times. Yeah, it can keep your bowel regularly. That's simple, right? Yeah, you don't need anything. Of course, you need enough water. You need balanced food. We talked about the food earlier, right? So that's this one will work, especially work better for if you are weak muscle or if you are elderly. You have age. It's reasonable for a person has been through many years, 70 years. Of course, it's different than 20 years old. So this one can help you. It don't cost anything. It don't cost you money. It don't cost you side effect. So that's how that works. Overall, we have to look at what causing us symptoms, and we use there's a health definition in holistic health. There's two. I will share two of them. One is health is the ability for a person to adapt in equilibrium in response to internal and external changes. So in this definition, the health is ability. What ability? Adaptation ability. If there's ability, you can learn, you can acquire it. So that's why I'm sharing my knowledge here. Another health definition is health is status or the process toward experience of wellness, unity, harmony. So it talks about can be status, can be now, can be a process. So I will not say you're out of health. You are still in the process for health. If you have been keeping yourself health, you are still in health because you are working toward. You make that as a process. You always toward health, and maybe the health can be different at a different age, different state, right? So that's why the health can be a process as well. Oh, maybe I can show you the point now. So 2 points, you want to do it, you can do it every day. Let's do this. You put your left hand, palm down in front of you, your right index finger on the bone, in the pinky finger side, the bone. Okay, press on pinky finger. That side, this side, here, here.
Oh, okay,
Here,
wrist.
here, yeah, the bone. The wrist, the bone on your wrist. No, that's that one. The pinky side, the
Right
big bone here. Yeah, okay. So now you turn your palm toward you. You don't remove your finger. What did you feel? Do you feel differently?
Warmth.
No. your finger was on the bone, right? When you turn, where your finger now,
It slips to the back.
right?
I agree.
Yeah. So your finger now is in a
Different.
yeah.
Different place.
Yeah, because
So you will see how smart your body is. You just move around, then they show you differently. So when you feel the dent, just press this point. Press this point. This point, the name in Chinese means aging care. So why the acupuncture, this meridian work, especially if you know the name of this pressure point, you understand more. You know, in here, so sometimes we'll just say stomach 36 or lung 6. You don't understand, you don't know, it's just a point. You don't associate. But if you associate with Chinese name, you know what it's for. So with this one, you press it like 2-3 minutes a day, maybe 1 time or 2 times, that's enough. Don't need to press it for too long. Yeah, just press it. So that's one point. What they do, aging care, we talk about the aging care, and they can prevent high blood pressure, or dementia, or some other arthritis. They can help too. You know, so many aging associated symptoms, so they will taken care of. So if you have already that, you know, if you already have the symptom for a long time, so there will be you need to go deeper for that. But this one, that can be preventative. So you prevent all these symptoms. So that's one point. Another point, it is on your wrist, in the middle, I see how measure it. So another way how to measure it also indicate it is individualized. Why? You know, you measure it. Okay, that's a middle line. You measure from the crease here. Use your thumb waist, measure 2, 1, 2. Okay, so this side, this in the middle, and the 2 measurement up. And the measurement is your own thumb. Not everyone, not 1 inch or 2 inch or any other measurement. It's your own measurement. Your measurement is your thumb one. 2 measurement. Press it. You know, I want you know, use this 2 pressure point every day, once or twice a day. This one can protect your heart. Yeah. This one.
how does it protect your heart? I don't quite understand that.
So that's go back to the meridian. The pericardial meridian is the one like the layer outside the heart. So we call it pericardium. Pericardial line is to help heart. So when you work on that, it can help with heart itself. Okay. Maybe I want you to try to another see if anyone feels different. In the middle of your arm here. So everyone try to see if you have any pressure in the just middle of your upper arm. Yeah, middle of upper arm. So see if anyone has a pain point or any sore point. No?
I understand.
Yeah. You press it on the midline from your elbow to your shoulder, middle. Just press on in the middle. Press, see if you feel any soreness, pain, or any feel different. Then you push and noisy.
There we go.
No problem then. So how is this different from, like, my father had a heart attack, I remember. Now I would say younger. I'm older than he was. So how was his? You know, he was, yeah. But how is this different from the habits you keep? Like you eat healthy. In other words, you eat your protein. You make sure you have well-rounded meals.
Okay.
And I remember when we were living in our own home, that was one of the things that I kept in mind. And he exercised. My father had exercised vigorously. Handball, I think, can be very taxing. Should I say that? It's a full exercise. How is all this different from that? Is it just keeping a touch on your arm or what? Don't you have to live a life where you eat right, you exercise appropriately, I guess, for your age? How is that different from what you're showing us? I can see my veins here, but I don't know if I'm putting up.
So, we want to look at the body health holistically. You said eating right and exercise.
Yes.
What if he over-exercise? Can be a problem.
Your muscles can hurt.
Not the muscle, your heart. If you
I've always thought about the extremities, just to get the heart pumping, right? Isn't that, you're gonna walk more vigorously. Although I think that's changed for me as I've aged. I just keep on trucking. I just keep on doing things, and I find a way to do it.
Yeah. So you understand your body symptoms. You understand your body symptoms has its meaning for you.
Yes,
So
I'm
you look
to it.
Yeah. You look at it, and what you feel is a good thing. You're doing it. You help me feel good. Just keep doing it. So there was nothing, and I only teach you for this 2 point. You can do it to additional help for you.
Okay.
Yeah. So what you have been doing, you're doing. You're doing exercise. Your arm, your legs. You continue doing it. So keep that flexibility, keep that strength there. So that's good. But let's see if a young man may be able to go to like 100 degree outside. For the elderly, probably you don't want to go there, right?
No.
So you don't want to go the extreme sports or exercise. Some people can increase the heart to 150 when they're young, but when you're old, you don't need to change it.
And you tend to take more. You take more care. It's common sense, isn't it? You're gonna wear a hat, especially out here in the sunshine on this side of the country. Back in Michigan, I would use it more for warmth than for shade. A hat, for example.
Yeah.
And so a lot of it is common sense, isn't it?
Yeah. That's what That's what I mean. So many common sense we forget in the healthcare. So that's why we are not care for health. We are just look at the disease, look at the symptoms. Even the symptom is not something bad thing. And when it first started, it's easy to manage. like somebody might be blood pressure high for one time, temporary, then you're taking care of, then we need to get down. If you continuously put it into your body, the toxicity, consistently for a long time, or you eat too much at one time. So that's both causing the problem. So anytime there's symptoms, you want to look at your body. You want to talk to your body, see what it tell me, what you try to say to me, listen to that. That's what you can take care of before you go to the doctor. Because when you have some other issue, major issue, you want to go to the doctor. They save your life. So that's what the doctor do. But the health is dependent on an individual.
I think that makes sense. And I always compare myself to my father, who was, that's not the thing to do, it's individual, right?
Yeah, individual. Yeah, he might have some other issue, factors you don't know. We don't know. You know, he might have some other issue. He did something wrong, maybe some other issue, or underline, or ignore, or forget. You know, if he's alive, we can talk about. But if we cannot. Yeah.
Yeah. But it's interesting. It's kind of interesting to think about that, because I don't have that kind of pride, and I don't think it's necessary. Yeah. Thank you.
Thank you.
Thank you.
All right.
Thank you.
Thank you,
Yeah.
guys.
If you have a question, and you can always talk to James or talk to Margaret.
Maybe we'll have you back for a second follow up because
Yeah.
we didn't have as much time as you needed, really.
Yeah,
So
yeah,
it's
yeah.
not much
I mean,
time.
the next.
Yeah,
Yeah.
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 Take care of this.
Thank you.
Thank you.